think this is a big change towards even gender equality and women empowerment. And in our organization, we do practice that. In fact, the T-Bus is an initiative by my partner and colleague Unka, who manages the entire operation by herself. And she's got a team of young people and a young 24, 25-year-old girl, Sejal, who manages the entire operations for the city of Pune. So we're very happy and very proud to be a part of this revolution for change of hygiene and change of sanitation habits for people here.
Yeah, this certainly is a revolution. So taking it further, now we have been discussing about urban areas when we are talking about the buses in cities like Pune. Uh, so moving further, looking at some aspects that would pose as challenges towards a country like India, there have been reports like even 5% of them are not getting enough water to wash their hands in the rural parts of India. So, what do you see challenges are there in rural parts, especially with the scarcity of water and other aspects?
See, the biggest challenge towards hand wash and everything that we spoke about is access to clean water. I think the other day, I think it was Matt Damon who said that water is prime. I think without water, nothing is possible. So providing water and clean access to water is the first step towards creating this change. In water stressed areas, I mean, the entire country is water stressed. And, we are nearing the summer months now. And this is probably the worst time and for water. But if you observe one thing, while you've been in lockdown, everybody is at home. And I don't think most of us in most societies, and I've been speaking to a lot of my friends, and they've been saying we've had no problems with water. We've got water supply that's on. We've not had to struggle. And what is the reason for it? The reason is people have become very conscious. People have become very aware, and they are saving water. They're making sure that they do not waste water. And as you go to the rural areas, this situation becomes even more worse. And that's one of the reasons the Prime Minister also has come out with this scheme of providing access to water to each and every family and home in rural India as well as urban India. And I think it is a very visionary strategy, because if you look at it, sanitation was the first thing that the Prime Minister announced, and the second one was water. And I think both these, which is water sanitation and hygiene, is a very, very relevant part of improving health and towards creating a very deep and larger impact to the people of this country. And as I speak about the scarcity of water, there are innumerable innovations and entrepreneurial efforts that are happening as we speak in the rural parts of India, whether it is by way of desalination or by way of water ATMs or by way of providing water with sensors, water with all kinds of cleaning methodologies and filtering systems, treating wastewater and converting it into potable water or drinking water. This kind of innovation and this kind of change is happening as we speak right now. And this is what is going to make a huge change. Therefore, water and sanitation both go hand in hand. It is very, very closely related. There is no water, there is no sanitation without water. And water is an inherent part of having clean sanitation. So as we speak, I think this integration of water and sanitation and the onset of all these illnesses and diseases and issues that are happening, it becomes more and more relevant that the space of water and sanitation, whether it is a form of business, revenue, industry, whatever you may call it, I think it is the most important aspect of our lives. And the more attention we pay towards the innovation and the strategies that we apply towards creating business models and ideas about saving of water or to reutilize this water, I think will create this particular change that we're speaking of. And there will be no scarcity of water really. Just has to be smartly used.
Right. So I would take your attention to one aspect that we have been studying. We have been working with tribals in Palghar district, and there have been number of dams that are coming up in that particular district, which are being built to address the thirst of city of Mumbai. And we have seen most of that there are reports where the Adivasis are not getting access towards the clean water. They are finding it difficult to have enough water to drink. And so we have to work on the water policies, as you have mentioned. At the other side, we are having cities where there are slums like Dharavi, where 1 million people are living in the area of 2 square kilometer. So that's 10 lakh people living so that in 2 square kilometers. So that is itself explains what is the requirement of sanitation, what scale that as we require for that, and what are the opportunities lying in this particular area. So, can you further elaborate on how education institutions, universities, how they are helping out in innovating in these kind of industries? Are they doing enough to help towards this particular industry? And what you should be expecting from universities, institutions? Which should they be come out with some sort of entity of their own, which has been studying it, which has been focusing on these kind of aspects? Would that be helpful?
Yes, definitely it will be helpful. But if you just look at even the issues of the Adivasis in Palghar, there are a lot of organizations, and we particularly work with one in Palghar by the name of Ra Foundation, and they have been doing some stellar work there in those regions, providing toilets and low water usage and low cost toilets for Adivasi villages. And they have been working also on numerous water conservation units and things like that. Now, one of the important aspects of water preservation and also providing access to this is the entire community working together. So it's not just about the universities providing research or the universities working in a specific area. It is the combination of all the stakeholders working together to create this change, and that is something that needs to be done at a government level. So the universities should provide data. For example, let's take an IIT or a NITI, that they are doing a lot of work, let's say, in this space, but they need to take this data, combine it with small and medium entrepreneurs, talk to certain NGOs that work in let's say, for example, the tribal areas of Palghar and the entire Thane district, get them together, make a plan and execute a pilot to begin with. Then we create evidence, because without evidence we cannot go forward. Once the evidence is created, once the data is there, then take it to the next level, which is scale. So it is important and necessary for organizations and all kinds of educational institutes that whatever, and this is my personal thought on this, is that whatever plan or whatever data is collected and whatever information is done, let's look at executing it to a certain level of scale. Let's not just collect data and make information just that's available for more research to be done, and it just lies in those libraries and in books for people to read and creates PhDs. But at the end of the day, if this is not utilized by the people or organizations towards a proper execution plan to scale, really I feel that this entire studies and all this information really goes a waste. So I would urge educational institutes to have an approach of a kind of a practicality approach, where they not only do research oriented stuff, but they work with live studies on the job, on the sites, along with organizations such as us or many others who are working in this space with NGOs, and create an environmental, or let's say an overall ecosystem impact, and not only a research oriented study.
Very rightly said, sir. We have to move to a research that would benefit the society. It has some application orientation. Most of it is going and piling up in the form of stocks in some corners of some room in universities and institutions. So we have to focus on that, especially when we are aware about what kind of emergencies humankind can face with no sort of any no not any sort of notification or something. So
Young
yeah,
people and really smart kids are doing this research and data, and they're collecting lots of information. But I think it is unfair to just have that data lying in universities. I think it needs to be brought out, maybe some kind of a mechanism or some kind of a digital system where all this data needs to be available at a certain platform. I've been a proponent of data and about collection of data towards utilizing it towards the right intent. And I think maybe someone in the IT space can come out with a concept for specifically for addressing this problem, and come out with some kind of a data bank which can be accessed by all these institutions all over the world for requirement in specific areas. So maybe that is a project that needs to be done, is collection of all this research that's done and to put it into to actual execution.
Right. So we are having some questions from the participants. So I would like to open it up for them as well. So can we unmute Mohana Vamsi Sharan? She's asking a question. So we can have a conversation with her.
Hello.
Hello.
Yes, sir. Myself,
Yeah.
Mohan Vamsi. I'm right
Yes. Yes.
now pursuing my post-graduation in environmental planning. So, with the present situation of COVID in major cities like Mumbai, Delhi, and if we consider the case of Hyderabad, the cases in the last few days have been increasing to a greater extent. So, what kind of opportunities can we youngsters today can have a thought of for the in terms of health and sanitation after the COVID situation in the country?
So I think you cracked up. I didn't hear the last part of it. Can you repeat that, please?
So basically, after the major cities like Delhi, Mumbai, and Hyderabad have a lot of cases coming up in the last few days. So what kind of opportunities do we have in terms of health and sanitation services that can be provided post the COVID situation in the country that we youngsters can actually be a part of and work towards it?
See, I think there are innumerable opportunities. You just have to keep your eyes open and you have to look for opportunities. You can literally sniff them out. I mean, just to give you a small example, just look at what's happened to the PPE industry. When this COVID thing started, India did not have sufficient PPE suits to provide our people. Today, we're the second largest manufacturer of PPE suits in the world. Just look at in such a short time the impact that we have created, and now we will soon have a surplus and we will be providing PPE suits to the whole world. At a smaller level, you can even look at providing portable sanitation services to places like Dharavi. A micro entrepreneur can come forward and say, okay, I'll provide 10 toilets in a specific area in Dharavi and make sure that with the necessary training and gear, we'll maintain these 10 units and generate a certain amount of revenue, whether it is on a PPP basis or whether it is on a contractual obligation. There are other opportunities, like, for example, setting up a COVID testing booth and young laboratory testing students or just graduates from scientific institutions can set up a small COVID testing booth and get maybe some kind of NABL certification or something from a Piramal Laboratories or Golwilkar or whatever, and set up their little franchisee outlets, which might be really beneficial to the larger companies. So this even working in tandem with the bigger laboratories, you could get lots of samples and swabs taken, improving the level of testing in the country. And if you talk about providing even water and the way the water is provided to these areas, you can come out with water ATMs, let people come out with their own things, put sensors so that you don't have to touch it. A small recent discovery of one of these people in Pune is where you have a hand sanitizer where it's foot operated. It costs some 1,000 rupees, and you just have to operate it with your feet, with your leg, with your foot, and then you just keep your hands under the hand sanitizer, and without touching anything, your hands are sanitized. These are small innovations and small kind of efforts towards coming out with really far-reaching impacts in this particular area. And this COVID-19 virus, I think, has created the amount of innovation and the amount of thought process going out. I mean, think about it. Companies that are manufacturing steel, are manufacturing engines, are now making ventilators. Look at the innovation and look at the opportunity that they have. So why not smaller companies and organizations look into such kind of things, whether it is providing a ventilator, whether it is providing PPE suits, or whether it is providing some kind of ICU equipment or some kind of beds or making bunk beds. There is so much that's going to be required for, let's say, the camps or the quarantine areas. Look at that opportunity, that you can provide maybe bunk beds there. You can provide a cleaning service. You can provide maybe meals in those areas. There is an opportunity that is really, really large. It's just a question of being enterprising enough and reaching out over there to provide this service.
Right. So actually, we haven't discussed and we haven't touched upon one aspect, that we have a huge bottling industry that could eventually come out of the situation. We have cinemas, multiplexes, so there is a plenty of availability for the business in this particular area. We would be definitely focusing on health and sanitation. Everyone would have to, otherwise they would lose on their consumers. So we just have to think differently. We have been going through a different era, which has been driven by the IT revolution and all, and it was very much organized. But this, with the whole of the government support, and sir, as sir has mentioned, the institutions like ADB and others who have been helping out, venturing into this particular industry, so there would be a lot more opportunities, I believe. So I would take up the next question, which has been asked by Mr. Pawan Kapoor. So can we unmute Mr. Pawan Kapoor, please?
Yes. Hi, Rajiv. We have been working in the industry together since so many years. During these tough times, we would like to ask you for the rental of these portable toilets. We are mainly working in events and construction sites and all. So, what are the other options that you have thought about to open up these open up different new opportunities that we can tap in these tough times?
Question, Pawan, and thanks for being on the on this forum. Pawan, there are many opportunities that are there, especially in this. Right now, the biggest requirement of portable toilets and whatever stock that you would have might be utilized at the various health camps that have been established in your area itself. If you can approach the municipality or the Zilla Parishad, whether just outside your city, you will be able to find there's a huge gap or huge requirement for these toilets and services, and you might be able to engage your entire inventory over there. I think the construction industry and the event industry, although will take a large dip this year, and there will be hardly any events, and you may not be able to provide any of your event equipment for these events. I would strongly recommend that do consider talking to the municipalities and the Zilla Parishads to first, the low-hanging fruit right now is the health camps. So to begin with, I would say that just head to the health camps and provide your services there. And I think in time to come, slowly but surely, there will be many other activities that also will come by. So just look out for this space. There will be a lot of opportunity that's holding and coming up.
We have, Raju, we have been supplying a lot of toilets to all the COVID centers in Mumbai and in Gujarat, elsewhere. And we are also tapping a lot of industries, because right now what I feel that to concentrate on the bigger, larger industries where means the big companies are renting huge number of toilets for their workers, for shower rooms and for toilets and all. So we have been successful in doing, in these 2 months, we would have mobilized around 1,000 toilets to all the industries only. So yeah. Industries is also a big sector that we have never been concentrating on, and we can move on that.
Yeah, I think that's great, Pawan, and I congratulate you on that. That is indeed a very big space, and it's a private space where you get paid immediately and directly. And it can be definitely explored, and you have the capabilities. If you have the capabilities in your space or outside your area, I think you'll be able to make a remarkable difference.
Thanks, Raju. Thanks. Nice talk.
Okay, somebody else has a question. Has put up their hand. I don't know.
Yes, sir. Actually, I would request Rohit to unmute himself and go ahead with the question he has.
Yeah.
Rohit, can you do that? Am I audible? Am I?
Very much audible. I can hear you.
Yeah. I guess Rohit.
You might want to ask his question if you want. Somebody else by the name of Yashwant also has put up his hand. You might want to check with Yashwant in the meantime.
Yeah, sure, sir. Sure.
Yeah, Yashwant, do you want to go unmute yourself and speak?
Hi Rajesh, Yashwant.
Yeah, go ahead.
I'm Yashwant from Lutel.
Yeah. Hi, Yashwant. How are you?
I'm fine. The question regarding that COVID or post-COVID, what do you think about the people will after the COVID will prefer the use the public toilet or not?
Of
What
course.
change will occur in the use?
So, of course, they will use public toilets. I mean, there is no question about it. See, look, this virus right now, the kind of reactions that are happening are all reactions which people are taking, I would say, super high precaution about it. Certain things will not change, for example, wearing of masks, gloves. But there are no instances, Yashwant, which are clearly indicating. And if I can send some links to you regarding the connection of sanitation with COVID. And in fact, it appears that using of toilets will not really impact and will not change this. I mean, unless, of course, you go into a toilet and you're coughing all over the place and you're already infected, then definitely that's going to happen everywhere. But provided you use masks and the necessary the necessary safety equipment that you're going to be using everywhere, including an airline. So definitely public toilets also would have the same impact. And there is no question about it. People will still continue to use public toilets. It's a question of time. However, providing public toilets or let's say an operator like yourself, you may have to step up your service levels substantially and maybe have to advertise or market yourself as a COVID-free environment toilet or a toilet with zero viruses. Probably tie up with one of the larger or smaller companies that provides high quality disinfectants, which ensure that the COVID virus is cleaned. Make it known to people that you spray and use XYZ disinfectant 5 times a day or 7 times a day, or an automated system that every time a person uses a toilet is completely disinfected with certain disinfectants, which will make sure that there is no COVID or any strains of the virus anyway. So you might have to step up your service levels, or maybe have to step up the quality of your service offering. But other than that, I do not see initially you might face a little bit of a problem in public toilets, but eventually it will come around, Yashwant. You don't need to worry about it.
Okay, thank you.
Right. So it was a very great concern that he has raised in the topic. Yeah, Rohit.
Yashwant runs a very successful a concept of business, which is a toilet and a loo together, a toilet and a little cafe together in Hyderabad. And his concern is very genuine that what's going to happen to his business in the future. And there are similar other concerns that people would have for public toilets. So I think it was a very valid question, and I think in the near future this will change. There is no doubt about it. I mean, all the private operators or the public operators of toilets all over the country will definitely have to step up their service levels and have to speak about and market their concept that the environments are clean and they're providing toilets where there is no chance of COVID. Every time a person goes in, we will clean it. So maybe it's an opportunity to increase the pricing in a way per use and provide high quality of cleaning. I think people will utilize that.
Indeed. Thank you.
Yeah, very rightly said. So Rohit, can you take up your question now? Rohit, if you can unmute yourself. Hello, am I audible, Rohit? Yeah, in the meantime, if anyone is having any questions, you can raise your hand, so we would unmute you. Now, this is a similar kind of question. Now, what would happen with the education, since I have been attached to education industry in particular, so would there be students coming to the institutions or not? So they have to. Similarly, with the toilets and other facilities, public toilets and other facilities, I think people would move on towards it eventually, with some precautions, of course, as you mentioned.
Look, this virus and this illness is here to stay. as I mentioned before, this is, and I'm not a specialist on COVID, and I probably know as much as you do, but being in the space of sanitation, probably we are aware of these kind of viruses and illnesses for a very long time, and we've been talking about using precaution and using a high quality of disinfectants and using toilets and hand washing for a very long time. But this is how it is until it really becomes if water is up to here, you don't realize these things. And our parents and our ancestors, everybody has been telling us this time and again. You tell your children also, the moment they come into the house, please wash your hands, wash your feet, use soap until from elbow to the tip of your fingers. Make sure that you do that every time before you eat. Don't put your fingers in your nose, in your mouth. Don't put it in your eyes. We keep telling our children and our parents and have been telling us this for a very long time. But like I said, that we need to make this change and this effort ourselves. And I think talking about educational institutes or come on, I mean, life is not going to come to a standstill. We are going to get out of this. This is, yes, a temporary situation, and we have to get out of it. And the herd immunity system will also take place, and this will also probably flatten the curve. But I think for now, we just have to be cautious, because right now it's peaking. There is a lot of uncertainty about this virus. There's not much information, and until the antiviral or whatever, the retroviral, the vaccine comes in, we are going to be a little more super conscious about it and more cautious about it. So I think the way is to just protect yourselves, keep the elders away, keep the young infants away, and make sure that you keep yourself safe, and not think about COVID so much. Make it a part of your life and just get on with it now. Because the more we delay it, the more we, let's say, are scared of it. It's still going to be. It's not going to disappear. So all of us eventually will have a certain strain or a certain element of COVID in us. But that's how the immunity will increase.
Very well said. So we have one more question from Miss Rupa. So if we can unmute Miss Rupa, and then we can take up question from Megha Mehta. So Miss Rupa, you can go ahead with your question.
Our organization is working in providing services for decentralized wastewater treatment as well as fecal sludge management through nature-based solutions. I just wanted to know if and like us, there are many private service providers who are working in this sector. I would just like to know if there are any opportunities in the current COVID scenario.
Yeah, I think, hi, Rupa, I think there are many, I'm sure that there are many opportunities, because the moment that you increase the number of installations, whether it's a COVID camp or whether it's a area where a small hospital or wherever, there is definitely going to be a requirement of treatment facilities. And if you see, outside the cities, the bigger cities, you will definitely have a opportunity, especially in the rural areas. And nature-based systems and worm-based technologies would be used very, very extensively now. And I think it could be even done at a very fast pace. So if you can reach out to more Zilla Parishads, where these, I'll just give you a quick example. In Maharashtra, for example, in a place like Zunnar, a lot of laborers, a lot of migrant workers have gone back to their villages. So a place like Zunnar also has today 50,000 workers have come back from Mumbai and Pune. Many of them are kept in quarantined in schools or in camps or in these wedding halls and things like that. You might want to reach out to places like that, where you know that the total capacity of sewerage in that area was X, and now because of the number of people that have come there, the number of people has increased, and the sewage disposal capacity is still very low. You might want to reach out to the COs or the SDOs in that area to offer them some kind of a mechanism, make it creative, make it innovative. You can say that you can provide it on rent for 3 months or 5 months, and now you can probably look at increasing, making it more permanent or larger over there, maybe using some kind of a modular system. So maybe it would be beneficial for you to reach out to the peri-urban and the rural areas more for the systems that you have.
Thank you. Thank you.
We can take up a question from Miss Mehta, Megha Mehta. Can you unmute? Komal, can you unmute Miss Megha Mehta? Hello. Miss Mehta, if we are audible, please go ahead with your question.
I don't think she's able to.
Yeah.
Maybe
yeah.
maybe she can just write it. She's not audible. She can just write it. Just type it in the chat and we'll answer it.
Mehta, if you can type it in the chat box, we would be definitely taking up your question. So meanwhile, in the meantime, we can take up one more question, which has been asked by Mohana Sharan. He's been asking, could there be any policy in this particular regard post COVID-19 situation from the government?
See, to create policy, first of all, we need to create a white paper. And maybe your organization, Sandeep, can help us create this. Maybe it could be beneficial to do a study, create certain amount of evidence on this and on a very short scale, sort of a short-term measure, by taking examples of various activities that have been done by organizations like ours or from Pawan's organization or probably organizations like Rupa's organization, put things together and create some kind of a study to reach out to government that this could be a policy that can be created. Because ultimately, if policy is to be created, it's to be done at the highest level in the government. But at least even some kind of a white paper created might give benefit from an organization like yours, would hold a lot of weight than just an association writing this. So maybe you could consider this as well.
Exactly, it would provide some sort of nudge towards creating a policy. We would definitely do that. So that is a great advice that I have received from you. So we have a team of people. We would definitely do that. We would like to do that.
Yeah, and we would be happy to provide the information and be a part of the study and help you with data.
Definitely, sir. I would. I think this should be the last question because we are running out of time. So it has been more than 1 hour, and we would not want you to be stuck with this for a long period of time.
Yeah, you can send questions to you, and we can answer those questions subsequently. Email these questions to the people who ask them. But yes, we are running short of time. And just to take the last question, are there any opportunities in the private sector for jobs? Yes, there are many opportunities for private sectors for jobs, and many of these organizations need good people. So if you have the capabilities of being a part of the sanitation and health sector, please be free to apply to all these organizations, smaller and larger companies, and I'm sure there will be something available for you.
Right. So definitely we should. I have been receiving many emails for questions, so I would send across to you so that you would help them answer it. And I think we should close now. And I must say that it was a great talk. We have been touching upon some aspects that we really mean that those are really special to us, but we have been ignoring it for years and years. And it is the time that we should be understanding it. We should be researching it. We should be studying it further and working on it very seriously. And with the expertise of someone like Mr. Rajeev Kher, it was a great help to understand it in great fashion, in better ways. And I'm very sure that most of us, or rather every one of us, would have the similar kind of feeling while we're in this discussion. So I'll just thank you, sir, for being here and spending your time talking towards us, answering all of the questions. He was very sure that he would take up all the questions that would come across and would not want to be a monologue or a lecture. So it went on like that, and it was a great discussion. It was great information. And thank you very much again for being here, joining us, and giving your time to us. And we would look forward to all of your suggestions and work on that in a very extensive manner.
Thank you very much, Sandeep, and wish you all the very best. And for everyone, stay safe. These are trying and challenging times, but we will come out of it victorious. Be enterprising, be look out for opportunities and let's make a change to the lives of people in India. Thank you very much.
Thank you, sir. Thank you.